Dr. Sierra, the first question someone emailed me is in terms of pain during their IVF cycle. So they have seen an infertility specialist, and they were recommended to do an IVF cycle, but they're worried that the hormone meds might cause more pain. Is that common? They normally experience a lot of pain during their cycle with their endometriosis. So does an IVF cycle increase that?
So thank you, Tavia, and hello to everybody. So I think that question is sort of twofold. So one is, does pain increase when you're doing the stimulation, when you're gearing up for IVF? And they're not necessarily. You're stimulating your ovaries. It just depends on where your fertility, where your endometriosis is. If you have enlarged cysts, and we're stimulating your ovaries, that can cause some discomfort, or it can cause your ovaries to feel more enlarged than otherwise if there were no cysts. Also, we do think that endometriosis is inflammation throughout the pelvis, which is responsive to hormones. So that could induce pain even outside of the ovaries in terms of bowel or bladder pain. So it's just something to be aware of. And you might feel it if you normally feel pain throughout the cycle outside of menstruation, then that may put you at risk of having pain during the stimulation. It's something for you to talk to your doctor about and have a plan in place for pain. The second part of pain with endometriosis, the procedure of egg retrieval can be painful. We do it under conscious sedation at Trio and Evolve. So you have medication that's titrated so that you're comfortable. But people with ovaries that have endometriosis, sometimes their pain can be even more so, more intense. It's again something to talk about with your physician as you're leading up to an egg retrieval procedure. There are things we can do, like we could start off with higher doses of medication. You could also see our naturopath team, Conceive Health, and have acupuncture as sort of an add on to your pain control during the cycle, before an egg retrieval, and after.
Thank you.
Okay.
Along from the same patient is they're wondering with their endometriosis, what happens when they do get pregnant and how does that present? What is it like in terms, I'm not sure exactly if they mean in terms of pain, but just overall, can you speak on endometriosis and pregnancy?
So endometriosis is given a break during pregnancy, so to speak. So pregnancy is suppressive. It's just almost like being on birth control pill or on Lupron. Your hormones are very quiet. Your ovaries are not active. You're not making a lot of estrogen from your ovaries, and so endo is very quiet during the actual pregnancy period. It's a bit of a relief.
Okay.
Mhm.
Um, could this lead to the endometriosis being better after being pregnant or changing how it presents after being pregnant and carrying a pregnancy?
It could do. So when we treat endometriosis, either medically or surgically, we always talk about a 6-month window after treatment where you will still have benefit. So if you consider pregnancy as sort of treatment in some respects, and that you're shut down, the endo is actively shut down, then you might have a period post-pregnancy for about 6 months where you don't feel necessarily all the symptoms you had prior. However, once your cycles resume, once the pregnancy is completely out of your system and certain time has gone by, it can present again.
Um, if someone has endometriosis and they're 30, how does that affect their fertility? The question is, should I consider freezing my eggs?
So, short answer, yes. So, endometriosis, endometriosis is one of these things that's progressive. It presents as sort of inflammatory deposits throughout the pelvis. So, in addition to producing symptoms like pain and scar tissue, it changes the environment that your eggs are growing, and it changes them in a way that quality is affected negatively. I consider it working along with age. It's almost like a double whammy. So, your eggs are going to age with time, but they're also going to reduce in terms of quality with endometriosis. So in prior days, when people presented with fertility issues, we would do a scope, we would laparoscopic surgery everybody to look for endo. And if there is endo, we would aggressively remove it. or if there were symptoms, we would aggressively remove it. But we found that that actually decreases your ovarian reserve. It causes pain. It causes decreased reserve and reduced fertility. So now our recommendations are if you have endometriosis, we know it's progressive. We know it's going to affect your egg quality just like age does. So you should consider your fertility before you consider things like surgery or aggressive treatment. And if you're young and you don't have a partner or you want to keep the option for a sperm source open, then yes, you should freeze your egg. Thanks.
Is it true that there is weight gain and hair fall side effects? I'm assuming this is with kind of the stimulation and the hormone process.
Yeah. So, not necessarily true. I think hormones in general, people will notice during a regular menstrual cycle, your weight might fluctuate. So it's sort of stable. And then after ovulation, when your body's making progesterone, you'll note that weight goes up because of water retention related to the hormones. So it's similar when we're taking hormones for stimulation. You're taking hormones initially to get your ovaries to be active, make lots of eggs. Up until that point, there isn't necessarily weight gain. But after the egg retrieval procedure, when your body's making a lot of progesterone, or if you're trying to conceive and we actually give you progesterone, you might note that you gain some weight, the sort of water buildup. But the important thing to know is that it's not permanent. It sheds when you get a period. So 2 weeks after an egg retrieval, most of the medication and these side effects go away. With respect to hair, it's not a known side effect. I think if someone's experiencing hair loss, they should check with their doctor to make sure there's not another cause like thyroid issues or iron deficiency or something like that.
And this one is asking about the government. Will the government cover the egg freezing procedure? So is that something that's covered by OHIP?
So that's a tricky question, and the answer is it depends. So if someone's presenting with such severe endometriosis that they're considering surgery for symptom control, like for chronic pain or very enlarged cysts that look suspicious or just extremely uncomfortable, and they're at risk of losing their ovaries as a side effect or expected complication of surgery. In those cases, we could consider putting forth the cycle as a funded cycle. So right now, the government funding program is covering IVF for people actively trying to conceive. And in cases, it's up to the doctor. So it's up to your conversations with the doctor and your presenting symptoms, whether we can put through a cycle for egg freezing that's covered.
Can eggs generally be frozen after the age of 40?
So I'm going to say they can be, but they shouldn't be. So at Evolve, we have a cutoff. It's sort of a soft cutoff of age 40. And the reason we have that cutoff is as we get older, the number of eggs that you need to give you a decent chance of pregnancy from frozen eggs increases so much that it doesn't make the egg freezing procedure worthwhile. So once we're over 40, we consider other options for fertility preservation, including freezing embryos. So finding a sperm source or selecting a sperm source or some anonymous sperm source and making embryos because they do much better with the freeze thaw process.
And so to expand on that, if someone were to be over 40 and knew they wanted to have a family down the road, but didn't currently have a sperm source, the embryo would be made, and how long could the embryo be frozen, or how long can the embryo be kept?
Indefinitely. Like once eggs or embryos are frozen, they could be frozen for 10 days or 10 years and have a similar outcome. So it doesn't matter how long they're frozen.
A general egg freezing question, it looks like here. I've heard that the probability of fertilizing frozen eggs isn't very high. Can you go through this and explain how successful the process is?
So again, it depends. So it's case by case. Of course, as we get older, it's harder. When we have young, healthy eggs, it's easier. In general, when we look at the literature at published data as a whole, we know that if about all the frozen eggs there are, about 80% will survive a thaw. And after the thaw, about 80% will fertilize. And then from the fertilized eggs, about 50% will make nice looking embryos. And depending on your age, it could be 1 or 2 out of 4 nice looking embryos that will be a baby. So there is a lot of attrition from the frozen eggs. And that's why, as we get older, we don't want to freeze eggs on their own just because it's less predictable how many are going to thaw and fertilize, et cetera, et cetera. And whereas when we have an embryo and we go to thaw an embryo, there's only a 5% or less chance it's not going to survive the thaw.
Um,
The other thing I'm going to say is that the probability of fertilizing frozen eggs, so it's based on our data to date, and we've only been doing social egg freezing for maybe 8 to 10 years. So we have to sort of have patience. And as more people come back and use their frozen eggs, right now only 10 to 15% of people have. But as more people come back and use their frozen eggs, we'll have much better numbers. And I suspect better rates at fertilization and embryo creation.
if I can add on to the as well to the person that asked that question, I know on the Evolve website, I can't exactly remember where it is, but there is a tool where you can go in and talk about or select from a click down menu your kind of family planning and what your ideal family size is, and then your age. And it talks about those and how many eggs you would need to freeze. So it talks and that's taken directly from those numbers that Dr. Sierra just gave. So it was a study
Yeah.
that was used with the attrition. And so you can do a little calculation there.
Mhm.
Okay, while we're waiting on some more questions in the feed here, I had another one online come into me today. They are they've been unable to get pregnant. They have now been trying to get pregnant, and they've been reading up on endometriosis, I guess, because it's Endometriosis Awareness
Mhm.
Month. They're not sure if they have endometriosis, but they feel like they have a lot of the symptoms. What's your suggestion, or can you give a diagnosis of exactly what the signs and symptoms of endometriosis is, and then
Mhm.
what to do and how to move forward?
So it's very sometimes endo can be tricky because sometimes it's obvious people have large cysts or large scar tissue or tubal involvement with their history of infertility, or they've had surgery for something else and they've had confirmed endometriosis. But then there's people who are silent. So silent endometriosis are tiny lesions throughout the pelvis that can just cause inflammation, or they can be small cysts that we don't necessarily see. And those are the tricky ones. So when someone has unexplained infertility, which is probably about half of the couples we see, half of the women and couples that we see walking through the door, the diagnosis is unexplained. And I'd say there's a percentage of those ones that probably have endometriosis. It's a conversation to have with your physician when you've been trying for a while and there's no clear diagnosis, especially if you have symptoms. So, symptoms include painful periods that don't respond to just over the counter Advil. Sometimes people have periods so bad that they miss work or they get nauseous. If you have symptoms outside of the regular cramping that we have with cycles, it's a red flag, or it's a sign to have that conversation, as well as pain outside the period. So if your PMS or your painful periods come with bowel symptoms, then that's another sort of sign, or bladder symptoms. Or if you have painful intercourse, those are also signs that, might get us thinking that there is some endo. And it's important whether or not we send you for surgery to have it definitively tested and treated. It does change protocols for egg retrieval, sometimes for transfer. So it is definitely a worthwhile conversation to have with your doctor to consider it if you have symptoms.
Another question on endometriosis. Can you speak about the difference between endo and adenomyosis? Am I saying that right? And how each differs with fertility, pregnancy.
Okay, so adenomyosis. So yeah, people get confused
Yes.
because they sound so much similar, but they are kind of similar. So endometriosis is when you have endometrial tissue or cells that have traveled backwards and sort of instead of through the cervix into the vagina, have traveled backwards in through the tubes and implanted throughout the pelvis. And then potentially some kind of an autoimmune defect or an inflammatory response that has that tissue become active and cause symptoms like pain and scarring. Adenomyosis is when you have those endometrial tissue or endometrial glands that kind of turn inward and invade the muscle wall, but they act in the same way. So they're endometrial cells, and so they're responsive to hormones and fluctuations, and they become inflamed in certain parts of our cycle and should sort of be shed in a normal menstrual cycle. But if they're implanted in the muscle wall of the uterus, they can't shed. So what it does there is it changes the appearance of your uterus. The sort of size of it gets bulkier because these glands are invading into the muscle. So as the size of the uterus gets bulkier, you have heavier periods, painful periods. We see it on ultrasound, and the shape of your uterus becomes what we call globular. Also, we see a lot of sort of changes in the density of the uterine muscle, which leads us to suspect there's adeno. The tricky thing about adenomyosis is we can't diagnose it unless we look at it specifically under a microscope. So we're not about to do surgery and remove uterus and look for it under the microscope. But again, if it's something suspected, it might have an impact of how an embryo transfer is done. It's something, that probably has been around for a long, long time, and we haven't gathered too much information on it. But nowadays, our imaging is so good, our ultrasound abilities are so much better. So we're seeing a lot more adeno, and there's a lot of active studies going on globally that are looking at the impact of adeno on fertility and what our treatment protocols should include if we suspect it.
My ovulation cycles aren't showing peak ovulation periods. Is this a result of endometriosis? I'm turning 36, if that makes a difference.
So, no, not necessarily. So, I mean, it's hard to talk because we're not having a conversation, but the first question I would ask in that scenario is, are you having regular cycles? Like, do you have 28-day cycles? Do you have symptoms of PMS? Like, do we know for sure that you're ovulating on a regular basis? Because there are other things that cause issues with ovulation. Endometriosis doesn't typically cause issues with cycles in terms of duration. Or ovulation necessarily. You'll still ovulate.
Okay, there's a few more here. One, and I don't think we fully covered this, but does having endometriosis affect being able to carry a pregnancy healthfully?
So again, a tricky question because I don't think anybody really knows. Now we have been looking at the impact of endometriosis on the lining of the uterus, more so in an IVF center or an IVF setting where we're doing embryo transfers. If we suspect endometriosis, then potentially we might treat frozen embryo transfer cycle or transfer cycle differently. Because again, if we suspect there's endo affecting a lining, we want to downregulate that somehow before we do an embryo transfer. But once a pregnancy does take place and it is positive and it starts to grow, again, it's going to suppress endometriosis actively. So it shouldn't be bothersome once we get a positive pregnancy test.
What foods, this one's on PCOS actually, but I don't know if you would want to speak to it on endometriosis as well, but what foods help eliminate symptoms of PCOS? And then maybe you can speak to endometriosis as well.
Mhm. So it's a big question. I think it depends on a lot of things when we talk about food and diet. Um, PCOS is different. So PCOS is a structural change in your ovaries where you have a lot more follicles than is typical. And what happens is your ovaries are enlarged, the hormonal environment's different, your ovulation might be off, and there's a change not only in the function of the ovaries in terms of estrogen and androgen production or response, but there's also a change in your metabolism in terms of how you process sugar and what your insulin levels are doing. So diet recommendations for PCOS tend to focus on that insulin glucose metabolism. So straightforward rule of thumb of PCOS is to avoid processed carbohydrates. I tell my patients who have PCOS to consider themselves almost allergic to things that are white, like white rice, white sugar, white potatoes, white flour, things that come in packages and are processed. And that's because of the glucose and the insulin imbalance. However, with endo, there are some people who believe strongly that diet also plays a role. In endo, what we use diet to address is sort of the theory that endometriosis is an inflammatory response. So there's an autoimmune defect that leads to implantation, but once implantation of these endometriosis cells happen, then it's an inflammatory sort of a monthly cyclical response. So in with respect to diet and endometriosis, people do address it that way. And they address it by encouraging diets that have low inflammatory properties. So there is a little bit of overlap when we think about those highly processed carbohydrates. But things that are inflammatory, and again, it's personal. You should see a dietitian or a naturopath to figure out what's inflammatory to your system. Some people it could be glucose, some people it could be meat. It just depends on everyone's composition. But you could potentially get a better response if you figure out if there are certain foods that don't react well with you.
How long does a Mirena IUD last to control endometriosis symptoms? I've had my ID for 3 years now, and it feels like the pain's been coming back a bit more.
So that's not unusual. It depends. Like, do you have a Mirena or a
It
Kylie?
said Mirena.
Mirena? Okay,
It
that's
said
right.
Mirena, yeah.
So Mirena should last 5 years, and they deliver continuous progesterone, which should suppress the endometriosis for 5 years. I've heard of it becoming less active towards the end of the 5 years. Um, and typically, your endo shouldn't progress while you have a Mirena IUD. But if you are having symptoms, it's probably worthwhile booking an appointment with your gynecologist and just having a chat. Number one, to see if the IUD is placed well. Number two, to see if the disease has progressed and that's why it's causing you pain.
We have one more question here. So if anyone wants to put in their last burning questions before we finish up. So if you have endometriosis, how long should you try conceiving naturally before going for IVF?
So that's a really good question. And the answer is it depends. So it depends on your age and it depends on your ovarian reserve markers. And to some extent, it depends on how long you've been trying. So remember how I said that endometriosis acts like a double whammy with age? So my advice with people who have severe endometriosis, who are over 35 and who want to have a family, especially those who want to have a family more than one baby, I think you should have a very short journey to get to IVF because not only will in vitro give you the best chances for a baby now, it's the only way to sort of preserve your fertility for the future. When you have a baby, you're pregnant for a year. Usually there's a delivery if you breastfeed, plus or minus. Sometimes it takes 6 months or to a year to have your cycles resume. So you're sort of away from actively trying for 2 years. So if you have endo and then you're taking a 2 year break, you could be jeopardizing fertility in the future. But IVF does let you have that option to potentially preserve pregnancies or preserve fertility for the future.
A follow-up to the question about the ovulation cycle. So the ovulation cycles weren't showing peak ovulation kind of periods. And they were asking about it being a result of endometriosis. They have tried hormone, like pregnancy sticks or whatever, ovulation sticks.
Yeah.
And there's no LH surge. They're not showing LH surge. So what would your recommendation or suggestion?
So if you're not showing an LH surge, then I'd be concerned that you're not ovulating. So again, I don't think that's part of the endometriosis picture. And my guess is if you're not having an LH surge, you're probably not having regular cycles. So you should probably see a gynecologist, especially if you want to get pregnant, and see if there's something we can do in terms of inducing ovulation and helping you time trying properly or better.
Okay. And that might have been, there's another one, that might have been a question about egg freezing. Does that, so maybe if you want to speak to a little bit, does it matter if you're not regularly ovulating, if you want to come in and egg freeze, or how does that process work?
No, we manipulate your cycle with birth control and go from there.
Um, I did, and this, I think this is speaking to the egg freezing as well, maybe.
Mhm.
I did a cycle 2 months ago. Can I start another time soon?
Yes. There isn't really any downtime between cycles, especially if you're doing cycles with any downregulation or priming before. Um, there's not much advantage to waiting a long time between cycles, especially if reserve is low or you're older or you just want to get it done as quickly as possible. 2 months is definitely more than enough.
Uh, this kind of ties in with that. So someone who has endo is over 35 and they want to have more than one child. Should eggs be frozen even if I'm older? So maybe we want to expand on what you were just saying about freezing.
So, yeah, I think if you have endometriosis over 30 and you want a family with more than one baby and you're single or you don't have someone to start trying right away, then I think egg freezing is a really good option. I'm not sure what she meant, even if I'm older.
Yeah, so she said she's over 35.
Mhm.
Should eggs be frozen even if I'm older? So
Yeah. So
maybe speaking to the age of them.
yeah, I think as long as your ovarian potential is good, as long as your reserve markers show that you can stimulate and generate follicles that we can retrieve a good number of eggs, then it's a good option for you.
Okay, and we have one more question here before we will wrap up. Does exercise help control endometriosis?
So again, if we think endo is an inflammatory response, anything you do to help yourself in terms of well-being is going to help with some of the symptoms of endometriosis. In terms of control, I'm going to say no because endometriosis is progressive and it advances beyond your control. But I think in terms of managing your symptoms, exercise is never a bad thing. Not that you should exercise extremely, but again, healthy, balanced lifestyle that includes exercise at least 3 times a week, 30 minutes enough to break a sweat is only going to be helpful.